with me now to talk about what this means for doctors and hospitals that disagree with the transgender ideology and the radical left's agenda is Roger Severino, Senior Fellow and Director of the HHS Accountability Projects at the Ethics and Public Policy Center. And he was a former director of the Civil Rights section there at HHS. Roger, welcome to Washington Watch.
Glad to be back, Tony.
All right. So what's the problem, Roger, with this update that Secretary Becerra has announced today?
Where to begin? Because there's so many problems. First, it doesn't follow any legal process whatsoever. It's just an announcement, essentially a press release, saying that they're going to now enforce a transgender mandate that has been the subject of litigation for years. When I was at the Trump administration, we spent years actually following the process, getting hundreds of thousands of comments, and rolling back on Obama-era transgender mandate that would have forced hospitals to provide sex reassignment surgeries against their will. So we followed the process, even the Obama administration followed the process. But now with Becerra, and you have activists like Dr. Rachel Levine at HHS pushing this transgender ideology, they're doing it with a wave of a hand, a flick of the wrist. We're announcing we're going to be enforcing these rules. No process, no public input whatsoever. It is a form of lawlessness, and the American people should stand against it.
So, that was an issue that people complained about in the Trump administration. It was so slow to get rid of some of Obama's radical policies, but that's because you followed the law, and that's the way it is in rulemaking. They just completely ignored the law in this case?
Absolutely. I mean, we are governed, unfortunately, by agency actions, by regulations, by rules, by unelected bureaucrats. At the very least, Congress put a break in there, and that's the rulemaking process. It allows for the public to participate, for people to let their rulers, which is the federal bureaucrats, know how it's going to impact them personally. So we took the comments, we responded, we followed the rule of law, and we undid the transgender mandate. Biden, Becerra, and Levine are saying, none of that matters. The people's voice doesn't matter. We're going to do what we're going to do. And worse than that, we're not even going to tell you how exactly we're going to impose the transgender mandate. How many genders do they believe there are? How many pronouns do we need to be using in hospitals and in science? They're not going to tell us, but they are going to have this loaded gun saying if you receive HHS funds, Medicare and Medicaid, or research at universities, you have to follow this new transgender ideology, but we're not going to tell you what exactly that means. You're just going to have to wait and see when we take enforcement actions to try to take away your federal funds. That's not the rule of law. That's sandbagging. That's lack of transparency. That's an abuse, because I think they're afraid of the blowback they're going to get when they start enforcing this mandate against people of goodwill.
So, Roger, I want to get into the substance of what they're saying they're going to do, but I just want to ask one final question on the rulemaking portion. This would be susceptible to lawsuits, I would assume.
Oh, absolutely. And more than just a procedural foul, this is about following court orders. There's an actual injunction in place in a district court in Texas that said you cannot impose a transgender mandate. It violates the Religious Freedom Restoration Act. It violates the APA. It's contrary to law. They can't just simply act as if that injunction doesn't exist, right? The Obama administration respected that injunction. They didn't enforce the transgender mandate. The Trump administration respected it, did rulemaking, followed the rules, and here they're just thumbing their nose at the courts. And this is breaking norms. The Biden administration is breaking norms left and right in the name of a very radical gender ideology. And if you don't get along, you're going to face losing federal funds. That's what it's coming down to.
Well, far from being a moderate, this is a radical administration. Let's talk about the substance here very quickly. This would affect medical professionals who now will be forced to engage in this charade that many are playing, but it has health implications as well as livelihood implications.
Oh, absolutely right. Healthcare, science, medicine are based on a biological reality of male and female. That's what it comes down to. People react differently to drugs based on their sex. We have entire wards dedicated for labor and delivery for biological females. The practice of OBGYNs is based on those realities. All that is at risk of being swept aside in the name of an unscientific ideology that's trying to wipe those all away and say they're just social constructs. That's ultimately what this comes down to. They will couch this in terms of anti-discrimination, but when the rubber meets the road, what is this actually going to do? It's going to say doctors and scientists have to ignore biological realities, treat people precisely as they self-identify in everything, including requests for surgeries, sex reassignment, removal of healthy reproductive organs, whether or not a doctor thinks it's bad medicine or it's against their religious beliefs or their moral convictions. If somebody says, I identify this way and I need you to use your medical skills to do this sterilizing surgery on me, tough luck. According to this new edict from Biden and Becerra, hospitals and doctors have to follow it regardless of their beliefs.
I would imagine that there are going to be a number of religious-based healthcare providers that are going to push back on this. At least I would hope so.
Oh, absolutely. And they are the ones who had sued and got those injunctions. I would hope that they push hard and bring this attention to the judges, because you can't be throwing around these threats willy-nilly at people without any rulemaking process, putting doctors under the gun, putting medical practitioners, insurance companies, and researchers who now have to wonder, what if I use the wrong pronoun? Am I going to lose all my Medicare and Medicaid funds? What if I actually treat somebody according to their biology if it differs from what they state their gender identity is? Are they going to be somehow liable in that case? And what if I'm being asked to treat minors to do sex reassignment surgery and remove healthy organs, and I disagree with that? Am I going to get an investigation from HHS and the weight of the federal government against me to try to shut down that person's medical practice? All these questions are now wide open because of this action today, and I would expect lawsuits to follow.
Insanity. It not only is it ignoring the rule of law, but it absolutely makes no sense. Roger Severino, thanks so much for joining us today.
My pleasure, Tony.